Welcome to another episode from the Veterinary Medicine Digest. We are gathered here today for a special edition of our journal club, designed to pull back the curtain on a silent, creeping tragedy unfolding within the brains of our most loyal companions. Imagine, if you will, the quiet hum of a veterinary neurology ward in the dead of night. A 16-year-old standard poodle lies in a cage, her eyes darting in a rhythmic, uncontrollable dance known as positional nystagmus. Just hours ago, she was a beloved family member with a minor history of forgetfulness, but now she is circling to one side, unable to stand, a victim of a sudden and catastrophic neurological event. For decades, we might have dismissed this as a simple brain tumor or perhaps a vague geriatric vestibular syndrome, but the research we are reviewing today tells a different, more complex story. A story of a protein that was meant to be cleared away, but instead became a molecular anchor, dragging down the integrity of the brain's delicate plumbing. This is the scandal of under-recognition. This is the story of cerebral amyloid angiopathy. To understand what is happening to that elderly poodle, we must first look at the human mirror of this disease. In the world of human stroke medicine, spontaneous hemorrhagic strokes account for 10 to 15% of all clinical cases. One of the primary culprits is a degenerative condition of the small blood vessels known as cerebral amyloid angiopathy. It is a disease defined by the pathological accumulation of damaging amyloid beta proteins within the walls of the small arteries, arterioles, and capillaries of the brain. By the time a person reaches their 70s, more than 50% of them will have pathological evidence of this buildup in their cerebral vessels. But how does this happen? The leading scientific framework suggests that this is a protein elimination failure angiopathy. Think of the brain as a high-functioning city that produces metabolic waste. In a healthy city, the garbage trucks, in this case the perivascular drainage system and the blood-brain barrier, move this waste out of the interstitial fluid and into the systemic circulation. But as the brain ages, or under the influence of genetic factors like the apolipoprotein E4 allele, the system begins to fail, the garbage begins to pile up. The specific waste product here is amyloid beta, a peptide produced when the amyloid precursor protein is cleaved by enzymes known as beta and gamma secretases. In the human brain, we see two primary players, amyloid beta 1-42 and amyloid beta 1-40. The 42 amino acid chain is the villain we most often associate with Alzheimer's disease, as it tends to aggregate in the brain tissue itself, forming the classic senile plaques that disrupt neuronal communication, but it is its shorter, more soluble sibling, amyloid beta 1-40, that takes center stage in cerebral amyloid angiopathy. This version of the protein has a specific affinity for the walls of the blood vessels. It embeds itself in the tunica media and the adventure, the muscular and outer layers of the arteries. This is not a passive process. It is a feed-forward loop, a vicious cycle that reinforces its own destruction. As the amyloid accumulates, it replaces the smooth muscle cells that give the vessels their elasticity. The vessels become brittle. They lose their ability to dilate and contract in response to the brain's needs, a phenomenon known as neurovascular uncoupling. Eventually, the vessel wall may crack or fragment, leading to the extravasation of red blood cells, a hemorrhage. In human medicine, we have a standardized set of tools to identify this before the final catastrophe, the Boston criteria. Using high-resolution magnetic resonance imaging, specifically sequences like T2 star-weighted gradient, recalled echo, or susceptibility-weighted imaging, clinicians look for the hallmarks of the disease. They search for cerebral microbleeds, tiny circular voids in the signal that represent old leakages of blood. They look for cortical superficial siderosis, a linear staining of the brain's surface with emosiderin, a byproduct of bleeding into the subarachnoid space. And they look for white matter hyperintensities and enlarged perivascular spaces in the centrum semioveil, which are indicators of chronic fluid stagnation and small vessel distress. But what about the dog? For years, the veterinary community viewed amyloid as a secondary finding, an incidental consequence of aging that had little to do with the acute clinical presentations we see in the emergency room. But a series of groundbreaking studies from institutions like the University of Tokyo and Cornell University are forcing us to reconsider. Let us dive deep into the pathology. Research has confirmed that dogs are predisposed to age-related cerebral amyloid angiopathy in a way that strikingly resembles the sporadic form seen in elderly humans. In one retrospective study of 69 necrocide dogs, researchers found that the occurrence of this vascular buildup increased significantly with age. In fact, in some cohorts of dogs over the age of 10, as many as 70% showed evidence of amyloid accumulated in the walls of their cerebral blood vessels. This amyloid isn't just a single substance, it is a spectrum of peptides. A pivotal paper from Takahashi and colleagues investigated the deposition patterns of 3 molecular species, amyloid beta 40, 42, and the recently scrutinized 43. Amyloid beta 43 is a longer, more neurotoxic, and highly amyloidogenic isoform that has been found in the cause of senile plaques in human Alzheimer's patients. In the canine brain, the researchers found a fascinating and troubling pattern. While amyloid beta 40 and 42 were present as expected, amyloid beta 43 was also frequently deposited in both the small arteries and the capillaries. The study revealed that in dogs, the capillary walls were positive for amyloid beta 43 to the same extent as amyloid beta 42, but they were almost entirely negative for amyloid beta 40. This suggests that the longer, stickier peptides like 43 are trapped upstream in the smallest vessels, while the more soluble 40-chain protein manages to move further downstream into the larger meningeal and cortical arteries. This is a critical distinction. When amyloid involves the capillaries, we call it Cerebral Amyloid Angiopathy type 1. When it stays restricted to the larger arteries, it is type 2. Dogs, it appears, are frequently victims of the more invasive type 1. These pathological changes have real-world clinical consequences. We must move beyond the microscope and into the imaging suite. For a long time, the veterinary world lacked the data to link these protein deposits to the symptoms we see in our patients. But new retrospective studies of magnetic resonance imaging findings in large populations of dogs are filling that gap. One study of 747 dogs undergoing brain imaging found that presumptive cerebral microbleeds, those tiny dots of signal void, were present in 19% of the population. Just like in humans, the prevalence of these microbleeds increased with age. Dogs older than 9 years were significantly more likely to harbor these lesions. But the researchers found something even more specific. Small breed dogs and female dogs were overrepresented. Poodles, in particular, showed a remarkably high prevalence of 45%. While some of this might be explained by the longer lifespan of smaller breeds, the data suggests a potential breed-specific susceptibility to cerebrovascular changes. These microbleeds are not just incidental findings of an old brain, they are linked to brain atrophy. One way we measure this atrophy in dogs is by looking at the size of the interthalamic adhesion, a bridge of tissue connecting the two halves of the thalamus. Research led by Curtis Dewey and his colleagues showed that dogs with these spontaneous microbleeds had significantly smaller interthalamic adhesion areas and heights than healthy control dogs. This shrinkage is a marker of a generalized neurodegenerative process, a shrinking of the brain city as its infrastructure fails. And what about the clinical signs? The dogs in these studies weren't just being scanned for no reason, they were coming in with central vestibular dysfunction, balance loss, head tilts, and flickering eyes. They were coming in with recent onset seizures. Some had the classic signs of canine cognitive dysfunction, the dog version of Alzheimer's, which includes confusion, reduced awareness, and the loss of house training. But here is the scandalous part. Many of these dogs had no obvious history of cognitive decline before their sudden neurological collapse. They were cognitively healthy, right up until the moment their amyloid-laden vessels finally gave way. In some cases, the leak isn't just a microbleed, it is a full-blown macrohemorrhage, a large, life-threatening stroke. Dewey and his team have collected data on senior dogs presenting with circling, abnormal mental status, and seizures who had large spontaneous intracranial hemorrhages on their scans, with no metabolic cause like a coagulopathy or high blood pressure to explain it. This brings us to a fundamental problem in veterinary medicine, the diagnostic gap. In human medicine, if an elderly patient arrives with a lobar hemorrhage, cerebral amyloid angiopathy is at the top of the differential list. But in veterinary medicine, because MRI is expensive and geriatric dogs are often seen as at the end of their road, we rarely pursue the definitive imaging required to see these microbleeds. And even if the dog is euthanized, a full necropsy with specialized amyloid staining is rarely performed outside of a few academic centers. we are likely looking at a massive underdiagnosis of a treatable or at least manageable condition. Why does this matter? Because if we know a dog has probable cerebral amyloid angiopathy based on the Boston criteria, now spelled out in their updated 2.0 version for humans and increasingly applied to dogs, we might change how we treat them. In humans, the management of this disease is focused on the strict control of blood pressure to prevent further ruptures. We are extremely cautious about the use of anticoagulants or platelet inhibitors, which can turn a tiny microbleed into a fatal macrohemorrhage. We also look at the risk of using statins in patients who have already had a lobar bleed. In the veterinary world, if we identify a senior dog with microbleeds, we might reconsider our use of certain medications. We might also implement preemptive treatments aimed at slowing cognitive decline, such as dietary changes, cognition-enhancing drugs, and environmental enrichment before the symptoms become severe. The research is also pointing toward the future of therapy. Clinical trials in humans are investigating anti-amyloid immunotherapies like ponesimab, which are designed to selectively target amyloid beta 40 and pull it out of the vessel walls. While these trials have had mixed results so far, they represent a revolutionary shift from treating the symptoms to attacking the molecular cause. Other researchers are looking at ways to enhance the garbage truck of the brain, using drugs like cilostazol to promote the drainage of amyloid through the perivascular pathways. As we conclude this deep dive, let us return to the pathology lab one last time. We see the brain of a 16-year-old poodle under the microscope. Her vessels are thickened, glowing with a yellow-green birefringence under polarized light when stained with Congo red. This is the congophilic angiopathy first described in dogs in the 1950s. We see the areas of acute infarction, the death of brain tissue where the blood supply was cut off. We see the marks of old hemorrhages in the medulla. The evidence is clear. Cerebral amyloid angiopathy is not an obscure curiosity. It is a major player in the health of our aging dogs. It is a disease of the neurovascular unit, a failure of the intimate communication between neurons and their life-sustaining vessels. It is a disease that robs our companions of their balance, their memories, and sometimes their lives. But knowledge is power. By recognizing the patterns of microbleeds on imaging, by understanding the molecular tug-of-war between amyloid beta 40 and 43, and by refusing to accept it's just old age as a final diagnosis, we can begin to offer these dogs a better path forward. We can bridge the gap between human and veterinary medicine, using each to inform the other in a truly One Health approach to neurodegeneration. The poodle in our story may not have had a simple tumor. She may have been a victim of a protein clearance system that simply couldn't keep up. And as we continue to refine our diagnostic criteria and explore new therapeutic frontiers, perhaps the next 16-year-old poodle to enter that clinic will have a different ending, one where the molecular anchors are lifted and the tiny highways of her brain remain open and clear. Thank you for listening. The titles for the referenced papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light and tails wagging.